We've all been there. An emergency strikes, panic sets in, and suddenly everyone's an expert. Knowing the right action can make all the difference. That's where emergency life hacks come in. These techniques can help you stay calm and take control. Imagine knowing how to treat a burn or care for a sprain. These skills are lifelines in unexpected situations. Preparation is key. Let's dive in and empower ourselves. Knowledge isn't just power, it's life-saving. We live in an age where information, both accurate and inaccurate, spreads like wildfire. While the internet has been a game-changer for accessing knowledge, it has also opened the floodgates to misinformation, especially regarding health and safety. In emergency situations, this can have dire consequences. Relying on outdated advice, home remedies passed down through generations, or unverified information from unreliable sources can do more harm than good. For instance, applying butter to a burn, a common yet misguided practice, can actually trap heat and worsen the injury. Similarly, inducing vomiting after suspected poisoning, once considered standard procedure, is now discouraged in many cases as it can lead to further complications. The key takeaway here is simple. When it comes to your well-being and the safety of others, rely on credible sources and up-to-date information. Always double-check any advice, especially if it comes from non-professional sources, and prioritize seeking guidance from medical professionals or reputable organizations like the Red Cross or the World Health Organization. Your health and safety depend on it. We've all experienced that irritating sensation of a foreign object in our eye, be it a speck of dust, an eyelash, or something more stubborn. Your first instinct might be to rub your eye vigorously, but resist the urge. Rubbing can actually scratch the delicate cornea, potentially leading to further damage and infection. So what's the right approach? If it's a minor irritant like an eyelash, try these steps. First, wash your hands thoroughly. Then, locate the object by looking in a mirror and gently pulling down your lower eyelid. If visible, try to flush it out with clean water or artificial tears. If unsuccessful, try using a wet cotton swab to gently lift it out. However, if you're dealing with something more serious like a piece of glass or metal, do not attempt to remove it yourself. Seek immediate medical attention. Trying to extract it yourself could cause more harm than good. Remember, when it comes to your eyes, it's always better to err on the side of caution and seek professional help when needed. Cuts and scrapes are an inevitable part of life, especially for those of us who embrace adventure. While a small wound might seem trivial, knowing how to care for it properly can prevent infection and promote faster healing. Contrary to popular belief, slathering on ointments or using old home remedies like butter or cobwebs is not the way to go. The key to effective wound care is keeping it clean and dry. Start by washing your hands thoroughly with soap and water. Then, gently clean the wound with cool water and mild soap, avoiding harsh antiseptics that can irritate the skin. Once clean, pat it dry with a clean cloth and cover it with a sterile bandage. Avoid the temptation to apply ointments unless specifically instructed by a medical professional. Ointments can trap moisture, creating a breeding ground for bacteria. Remember, a clean, dry wound heals faster. If the wound is deep, bleeding profusely, or shows signs of infection, seek medical attention immediately. Section 5. Beating the heat. Safe fever management. Fever is a common symptom of illness, indicating your body is fighting an infection. Manage low-grade fever at home safely and effectively. Avoid using rubbing alcohol or vinegar on the skin. These methods can cause skin irritation or toxicity. Keep the individual comfortable and hydrated. Encourage fluids like water or clear broth. Dress in light clothing and maintain a cool room. Use fever reducers like acetaminophen or ibuprofen as directed. Seek medical advice if the fever is high or persistent. Addressing fever safely is crucial for recovery. Section 6. Oh, they fainted. Now what? Fainting, a sudden loss of consciousness, can be alarming, but it's often temporary and not a cause for major concern. However, knowing how to respond appropriately is essential. If someone faints, resist the urge to immediately lift them to their feet. This can actually hinder blood flow to the brain and prolong their recovery. Instead, gently lower them to the ground and elevate their legs slightly above heart level. Loosen any tight clothing around their neck or waist to improve circulation. Ensure they have plenty of fresh air by opening windows or fanning them. Most importantly, stay calm and reassuring. As they regain consciousness, help them sit up slowly and offer a sugary drink if available. If they remain unconscious for more than a minute or two, experience repeated fainting spells, or exhibit other concerning symptoms, seek immediate medical attention. Section 7. Burns. Cool it down, don't slather it up. Burns, ranging from minor scalds to severe charring, require prompt and appropriate treatment to minimize damage and promote healing. Forget the age-old advice of applying butter, toothpaste, or other household substances to a burn. These remedies are not only ineffective but can also trap heat, worsen the injury, and increase the risk of infection. The first step in treating a burn is to cool the affected area immediately. Run cool, not cold water over the burn for at least 15 to 20 minutes. Avoid using ice, as it can further damage the skin. After cooling, gently pat the area dry with a clean cloth. If the burn is minor, you can apply a sterile non-stick dressing to protect it. However, for severe burns, larger areas, or burns that blister or char, seek immediate medical attention. Remember, prompt and proper care is crucial in minimizing the impact of burns and promoting optimal healing. Section 8. Dislocations and sprains don't play doctor. Dislocations and sprains, while common injuries, can be incredibly painful and debilitating. They often occur during sports or falls, causing joints to move out of alignment or ligaments to stretch or tear. While the internet might tempt you with DIY relocation techniques, remember this golden rule: never attempt to relocate a dislocated joint or pop a sprain yourself. Doing so can cause further damage, potentially leading to long-term complications. Instead, focus on immobilizing the injured area using a splint, sling, or brace. Apply a cold compress to reduce swelling and pain. Over-the-counter pain relievers can also be helpful. Most importantly, seek professional medical attention immediately. A healthcare professional can properly diagnose the injury, perform a safe relocation if necessary, and recommend the appropriate treatment plan, which may include immobilization, physical therapy, or in some cases, surgery. Section 9. Share your story, stay safe. We've journeyed through some essential emergency life hacks, equipping ourselves with the knowledge to respond effectively to various situations. Remember, these tips are just the starting point. Continuously seek out credible information, attend first aid courses, and practice these techniques regularly. Your ability to stay calm and act swiftly can make all the difference in an emergency. Now, I challenge you to share your own first aid stories and the lessons you've learned along the way. Spread the knowledge, empower others, and together, let's build a community equipped to handle the unexpected. Stay curious, stay prepared, and stay safe out there.